And now it's time for The Doctor Is In.
Hi, I'm April Douglas for The Doctor Is In, and today our guest is Dr. Lori Fleck with USA Health and Associate Professor of Urology. Thank you for being here, Dr. Fleck.
Thank you for having me.
And the topic today is reoccurring urinary tract infections. First, just tell us, what is a urinary tract infection?
A urinary tract infection is a bacterial infection in the bladder that causes a variable symptom complex from just bladder problems to fever, chills. It can be pretty severe.
We were talking about that earlier. And is it primarily diagnosed in women?
More often than men, correct.
And what are the factors, the risk of those urinary tract infections?
So most of the women that get urinary tract infections are postmenopausal. That's the more common age group. Many of us don't drink enough water. We don't empty our bladder as often as we should. Our hormone balance gets out of whack, and all those things increase our risk of infection.
Now, what are some symptoms to be on the lookout for if you're concerned that maybe you do have one?
Right, the number one symptom is burning with urination, and then a lot of times they're associated with urgency to get to the bathroom, a painful pressure in the bladder, incontinence even can happen. That's usually in the younger to middle age group. One of the concerning times is older women. I think we were going to talk about that at some point, but a lot of older adult women do not have those typical symptoms. They don't complain of any urinary problems, but they start to get confused, lose their appetite, maybe run a low-grade fever, and those are the only symptoms they may have of an infection.
And you should seek your doctor out immediately, or how, if you shouldn't ignore these.
That is correct, because they can get more severe, turn into a kidney infection, which may require hospitalization.
Now, I think I've always heard this, that antibiotics could cause it. Is that true?
An antibiotic can't cause a urinary tract infection, but just because you're on an antibiotic maybe for a sinus infection doesn't mean it would protect you from getting a urinary tract infection. So if you had symptoms of a bladder infection, you still need to seek your doctor's attention.
Now, Dr. Fleck, there are some things that we can do to help prevent UTIs, right? What are some of those things?
There are. So back to the drinking water. It's very important to drink at least 60 to 80 ounces of clear fluids a day and go empty our bladder every 2 to 3 hours. To flush the system is very important. Also, that hormonal balance I mentioned, a lot of postmenopausal women may take a systemic hormone, but they don't have enough hormones to the vaginal tissue, and then the pH changes, and that increases the risk of infection. So something as simple as a topical estrogen cream can make a world of difference.
And don't be embarrassed to talk about this. This is natural, right?
It's been kind of taboo.
I'm going to cut you off because we are going to continue that conversation on our social media. Lots of information, Dr. Fleck. We'll hope you join us on our Facebook page.